Tonight asking the question, what's the point of the Met Office? First on Radio 4, Rewinding the Menopause, with the writer and geneticist Arati Prasad. In the programme, Arati asks whether women should look forward to new research into reversing the change of life, or accept it as a natural part of ageing, with all the health difficulties and attitudes it can evoke. She found that many women were unwilling to talk openly about the menopause, and some agreed to be interviewed only if their names were changed.
What's the difference between a pit bull and a woman in menopause? Which is scarier, a puppy or a rational woman in menopause? What's 10 times worse than a woman in menopause?
The menopause, the change of life, hot flushes and women's problems are the butt of many jokes.
What's the quickest way for a man to end up sleeping on the couch? Why do women stop bleeding when entering menopause? Because they need all the blood for their varicose veins.
They're often offensive and fail to consider the very real problems, mental and physical, that many women face.
I was in probably one of the best jobs in my life, really. I was at that age when I'd worked for it, and then suddenly I was confronted with hot flushes and, going bright red and sweats pouring down my face, and really struggling to carry on with things, do a presentation or whatever I had to do.
Yes, I've been in a meeting sort of where it's crept up my neck, this sort of exploding with heat, and my face must look like a tomato.
I think everybody around me could see that I was trying to carry on as if nothing was happening, really. And
at its very worst, women lose careers, they lose relationships, they lose partnerships.
One of my friends warned me that it could go on for about 5 years, and I think it probably did. Most severe, probably about 18 months, and I did actually pack my job in at that time.
And what compounds that is when younger members of staff, or male members of staff, they'll make a joke, and that just makes it worse.
One thing that's certain is that as women, we'll all go through the menopause, whether it's in our 40s, 50s, or for some unlucky ones, even earlier. And it's something which is no laughing matter. Menopause means a woman's periods stop because she's running out of functioning eggs. I'm Dr. Arati Prasad, and in this programme I'll be looking at whether it's possible to rewind the menopause, or once our eggs run out, is that it? Should we just accept it as a natural part of ageing, or a condition we should treat? And why don't people, even some GPs, want to talk about it? But let's start at the beginning with new research, which, although still controversial, may eventually help delay the menopause by kick-starting the production of new oocytes, human eggs.
This is footage of a human egg being born. The egg puffs up like a balloon from a bed of stem cells and wiggles its way into existence.
This extraordinary sequence opened the door to a new way of thinking about the human egg. It's from a short film by the leading scientific journal Nature, about the research of American reproductive biologist Jonathan Tilley.
The prevailing dogma in our field for the better part of the last 50 or 60 years was that young girls are given a bank account of eggs at birth that's not renewable. And as they mature and become a woman and they use those eggs up, the ovaries will fail and they enter menopause.
What really excited Professor Tilley were his experiments, which he says identified stem cells in the human ovary, cells which he believes a woman could use to replenish her eggs. Top of the bank account, if you like.
A major breakthrough that's reported in the Nature Medicine paper is the ability to isolate these cells and purify them.
A labeling protein tags the cells to make them glow green. The green makes the stem cells traceable. Tilley's lab injected some of them into human ovary tissue and transplanted this into a live mouse. There, the green cells matured into new human eggs.
And we knew that day, and the hairs are standing up on my arm, that indeed these cells existed in humans. I think probably among every other observation we've made, that has to be the most important.
In 2004, when Tilley's paper was first published, he faced a barrage of criticism. Professor Evelyn Telfer at the University of Edinburgh was one of the skeptics.
So I've worked in the ovary for many years, for over 30 years. The idea of there being germline stem cells has been contrary to everything that I've understood about the mammalian ovary, and that the supply of eggs run out at a certain time, and therefore there must be a fixed population.
More than a decade later, much of the scientific community still remains to be convinced, although Telfer is changing her view.
I was involved in critiques of his work, and eventually, probably 2009, I began to say, well, there is something in this.
How does the scientific community receive this now?
You know, some people would still say that they don't exist. And I think that's a kind of flat earth approach. We're not making big claims, we're simply saying that we can isolate a population of cells that have characteristics consistent with germline stem cells.
I wanted to see these cells for myself, so I visited Telfer and her team at their laboratory in Edinburgh.
Dr. Marie McLaughlin, I'm a postdoc in this lab, and I'm a variant biologist, and I've been working with Evelyn for 12 years, I think. Right now we can identify the cells, we're confident that these cells are what we think they are, germline stem cells. It's exceptionally exciting. And we're going over to the inverted microscope to see them clearly. So I'll look at them over in this one.
So I looked down the microscope at the petri dish of stem cells, some of which appeared to be rounding up into what could become eggs.
So at this stage these cells are long, they're elongated, and the cell body is a slight bulge, usually in this sort of along the centre of the cell.
So you're tagging them so you can follow their development of that specific cell?
Yes, they would have a marker put into them, and then we would inject them into tissue, and then the tissue is, you know, prepared so that we can actually look at it, and that's when we see that they've formed what looks like eggs.
For a long time there has been a taboo around the subject of menopause. It is not talked about enough. Symptoms have often been discounted, but actually significant numbers of women can suffer severely from flushes, from sweat, sleep disturbance, joint aches, low mood, difficulty coping.
Gynaecologist Dr. Heather Curry is chair of the British Menopause Society, which supports and educates health professionals.
Then there are also the specific effects of the lack of estrogen on the vagina and the bladder, and we know that many women suffer as a slightly later consequence of estrogen deficiency on vaginal dryness, on discomfort, on loss of elasticity or stretchiness of the vagina. All this can have a huge effect on sexuality, and if women have sex and it's painful, they're not going to rush to want to do it again.
Relationships can suffer. Marriages can fail. The impact of the menopause on women's lives is only too evident among the women who contact forums such as Menopause Matters, which was set up by Dr. Curry. Thousands have shared their experiences online. And it's not just physical problems. Emotional and mental symptoms can take their toll. Elizabeth went through the menopause at 41 after the birth of her third child, and to begin with, she had no idea what was happening to her.
I began by feeling very anxious and agitated, and then gradually got quite depressed. I think it must have been depression, feeling I couldn't cope with things, mood ups and downs, swings, and I eventually felt so awful I just went to the GP.
I mean, we are all unique, really. We're all individual, and the way we produce hormones, the way we react to hormones is very different. So it would be nice to be able to control the way we have our hormones. Estrogen is a good hormone. Estrogen is good to have around. Our bodies do suffer from the lack of estrogen, which is what naturally happens when our ovaries stop working because we supposedly run out of eggs. But the way we take the estrogen and the effect on the womb lining related to periods, we could do better if we were redesigning women today.
I had a blood test and it came back that I was undergoing menopause, and so the GP gave me some HRT tablets and said I'd feel like a different woman within about 4 weeks.
But Elizabeth didn't feel better, and in the end came off HRT, hormone replacement therapy. A year later she developed breast cancer, from which, fortunately, she is now completely recovered. Some research has linked a risk of breast cancer to HRT and resulted in less women being prepared to go on or even being prescribed treatment by their GP. It is now generally accepted that the health risks of not taking HRT outweigh those of taking it, yet some women would prefer something more natural, particularly if they suffer an early menopause with many years of treatment ahead. Evelyn Telfer is cautiously optimistic about the long-term future of her and Tilly's research.
These cells have been associated with reversing the menopause, mainly because because, you know, eggs run out at the menopause. We have very, very few eggs at that time. So the idea that if these cells function and they can form new eggs, then of course one of the clinical applications would be in the treatment of premature ovarian failure. So women who have early menopause, there might be the potential to, you know, help them, but it could only happen if you understand both the cells that we are working on and any other cells that might support them. As yet, we've not tested their ability to be fertilised.
So that would be the next step.
Yeah, absolutely. And we're close to that with our cow work. With the human work, then there's a lot more bureaucracy involved in terms of getting licenses and so on.
What we can say just now is it's very, very promising, and we are very uniquely placed because of our clinical collaboration in the Royal Hospital a few miles away, that we do have a good regular supply of tissue in order to keep these studies going. And human tissue really is the only appropriate model for human work, and we're very lucky to be in this situation to be able to do this just now.
Working with human tissue raises both ethical and legal issues, but Telfa's team have a fortunate collaboration with Edinburgh's Royal Infirmary. The hospital has been leading the way, storing for the past 20 years ovarian tissue from women suffering premature menopause. Clinician Dr. Richard Anderson works with such women.
The ovarian tissue that we're storing contains eggs within follicles before they've started to grow at all, and that growing process happens, well, it starts every day in women of any age, from birth right through to the menopause. Actually, you have your most eggs when your mum's about 5 months pregnant with you, in the millions, and actually the majority of them have already been lost before you're even born. So at birth you're perhaps down to about 1 million, and then it carries on progressively getting less and less, and the menopause is thought to happen when you get down to about 1,000 or so.
A recent birth in Belgium hit the headlines because the young mother was the first in the world to give birth using transplanted ovarian tissue, frozen when she was still a child. Globally, around 40 successful births have resulted from ovarian transplants, mainly in older women.
Well, the women in whom we're making a diagnosis of an early menopause are at any age, essentially. Often it's not picked up, of course, before the natural age of puberty. So we might be seeing girls of sort of 15 or 16 who have not gone through puberty, and actually the reason they haven't gone through puberty is because they've effectively already gone through a menopause. They could have a specific condition such as Turner syndrome that causes that, but in many cases it seems no particular cause can be found, or sometimes it's because they've gone through cancer therapy that's damaged their ovaries.
I'm Julia, I'm 18 and I'm working full time and I'm going to uni in September. I was always fine, never ill or anything, and then I had Hodgkin's lymphoma. I was about 11, 12. I had 6 months chemo and then I think about 3 weeks of radio. But all in all, about probably a year I was quite unwell for.
Faced with a dreadful diagnosis of cancer and an uncertain future, you've got to think about the quality of that future for them right at the beginning, because if you want to do anything about preserving their fertility, you really need to do it before they start their treatment.
Dr. Hamish Wallace is Professor of Paediatric Oncology at the Royal Hospital for Sick Children. He believes around 1 in 10 of his young cancer patients will benefit long-term from freezing their ovarian tissue.
These families' lives are completely turned upside down. One minute they're thinking about their summer holidays, the next minute they've got a child who has got a life-threatening illness, and some of the families took a little double take and said, well, the doctor's talking to me about all this horrible treatment that I need to get myself better, but actually he's now talking about fertility in the future, so maybe he actually believes I'm going to get better.
I wasn't really thinking about further down the line. I was just more thinking of, at the time I really didn't want to get another operation, but they especially my mum and dad were like, I think you should definitely get it. I'm glad I done it. I'm glad I changed my mind on the day and done it, just for the future really.
Julia has effectively gone through the menopause, and whilst many of her friends may be taking the contraceptive pill, she is taking a different pill, HRT, to avoid health risks such as osteoporosis.
Julia, we were talking about the fact that it's really quite a long time since you had your treatment, and you need to take what we call hormone replacement therapy to protect your bones. If the body doesn't produce estrogen naturally, then the bones can become
really like taking it. I don't like the way it makes me feel. It just kind of makes me kind of more annoyed and agitated if I take it. I prefer to not have it, kind of take it at all.
Your bones also took a bit of a hammering with the chemotherapy. And I don't know if you remember, but during your chemotherapy, you actually found it quite difficult to walk because your bones were sore. And when we did scans, we found that there were things called bone infarcts, and they've continued to cause a bit of a problem, haven't they? So there's two sides to it. One is we're doing ovarian tissue cryopreservation in our young patients with cancer, potentially to restore fertility. We're not doing it for hormone replacement therapy at the moment. But all I'm saying is that you could argue, and some have argued, that this tissue might be a resource for natural hormone replacement therapy because women are living longer, and there's no doubt that the body needs to see estrogen, and that will prevent against osteoporosis. Should I be recommending to, for example, my daughter, have one of your ovaries out, let's put it in the fridge. If, when you go through the menopause at the age of 50, this could be a source of eggs for you. Every 4 or 5 years we could put back another bit, and your body would see natural estrogen. It's a really difficult one, isn't it? Because it's an additional procedure. So would you want your daughter to go through and pay for a general anaesthetic, laparoscopic collection of a whole ovary taken out?
I'm the Professor of Clinical Reproductive Science at the University of Edinburgh. Theoretically, the ovary could be put back at any age. Whether it's appropriate is, of course, a very different story. And one would imagine that putting the ovary back into a 60-year-old woman, there's no reason to think why it shouldn't start working just as it would if you put it back when she was 35. So one option with replacing ovarian tissue would be that you could at least theoretically do it repeatedly and perhaps insert some under the skin of the arm that would then be there to produce hormones rather than to induce fertility.
Across the pond in New York, Dr. Kutluk Oktay has been doing just that. But in the case of his patients, it's to help with fertility.
We did the transplantation under the forearm skin, and later on with certain patients we grafted them under the abdominal skin. In terms of patient experience, some of our patients, for cosmetic reasons, they had to wear long sleeves because when the egg is about to ovulate, actually you can almost see it under the skin. But the patients felt quite normal, and one of my patients told me that she just started feeling exactly the way she felt before she became menopausal.
We are now seeing more and more first-time mothers in their late 30s and 40s, as opposed to their early 20s a generation ago. Images of older celebrity mothers showing off their babies, and the simple fact of women increasingly spending what are the most fertile years of their lives in education and building their careers means that by the time a woman is thinking about children, she may already be, in medical terms, well on the way to menopause.
As I'm sitting at my desk in New York City and just review the patients I've seen today, and they're all here because of either they have delayed childbearing for too long, or they have had some kind of cancer treatment, or they are going to have something that's going to affect their fertility. This is the problem of 21st century. As a matter of fact, most people see menopause as a modern life phenomenon. Since 100 years ago or so, women didn't even live past menopausal age. With the advent of all medical technologies, now women can live quite healthily into their 70s, 80s, and that means they have to spend close to half of their adult life in menopause. And if you could figure out a way to affect menopausal age so that it's more proportionate to the lifespan, the current lifespan of women, then there would be fewer problems.
What would you say to people who argue that the menopause is natural and so we shouldn't treat it like an illness or further medicalize women's lifestyle?
Yeah. So I would tell them that if your wife is having a baby and baby is too large and won't come out, well, natural birth is natural. Let's not do C-section and let the baby or the mother or both die. Alzheimer's, cancer, or heart disease is natural. It's just part of aging.
If we're still searching for the Holy Grail that will keep us forever young and never dying, I can see that the menopause is a very visible sign that women are aging.
In London, as an obstetrician for the past 30 years, Susan Bewley has seen too many older women with life-threatening illnesses, both in themselves and their babies, due to later pregnancy. Professor of complex obstetrics at King's College, she reminds us that it is more natural for a woman to have a baby in her mid-20s. Just as in her 50s, the menopause should be seen as a natural process of aging, requiring minimum intervention.
Why are scientists, largely male I may say, trying to cure us of being women? I think the menopause is a natural life event, just like adolescence. And although it's a bit traumatic, all those hormone swings and mood swings, and clearly there are some very unpleasant symptoms as you transition through the menopause, nevertheless, the menopause has evolved over millions of years. One theory is that the menopause is very good for women because it spares them from the dangers of childbearing late in life, which is potentially fatal, and it frees them up so that they can help with the care of their own grandchildren. So I don't think of the menopause as an evolutionary mistake. I absolutely cannot accept that a natural life transition for women makes us 50% of the population of the world somehow wrong, disordered, diseased.
I was only 45. My menopause was surgically induced because it was suspected that I had ovarian cancer. So I had a total hysterectomy, including my ovaries, and that was 3 years ago.
When Diane went through her menopause after surgery, it was so devastating she needed something to be done.
About 6 months after I had the surgery, I essentially fell off an emotional and mental cliff. Became very reclusive, became very tearful, felt useless, worthless, hopeless, a complete waste of space. So if we look at the Menopause Matters forum set up by gynaecologist Heather Curry, you know, kind of regularly, you will see women who found the forum for the first time coming on and saying, you know, thank goodness I found this, I thought I was going mad.
We have seen women who really struggle, women who have to leave their work early, who have family and relationship problems that could be treated.
And in fact, you know, when I was struggling myself, I started to look at forums to see if other people were going through what I was going through. And there was one particular comment which really struck a chord with me, and it was actually from a man, and it was posted at 2:30 one morning. And all it said was, can somebody please help me? I think my wife's going mad. It's not just women who need help. It's the families of women. It's their husbands. It's their partners. Because they see this person change and they have no idea what's going on.
For Diane, during those dark days, the main source of comfort were her horses.
It's just really therapeutic, you know. Groom him and stroke him and kiss his face. We love him, don't we?
But she finally had to accept that HRT was the answer. Later this year, the UK's healthcare guidance body, NICE, is expected to issue guidelines about the treatment of the menopause, which Dr. Curry hopes will improve what women can expect from their GPs and other health professionals.
That's due to be launched, the final document, in November. And that is a really exciting opportunity, not only because this will at last produce an authoritative, well-recognised guideline which is noticed throughout the world. It will dispel myths about menopause and about treatment options, and we're also sure that it will provide the opportunity to raise the profile and the awareness of the importance of menopause and about treatment options.
As to the clinical application of Tilly's stem cell research, Dr. Octay believes it may eventually have a future in rewinding the menopause, or at least slowing it down.
So with the first scenario, let's say that we slow down the process so that nobody goes to menopause until they are 60, or in the second case scenario, you extract these cells which can renew themselves, and since this is still an experimental and not clinically tried approach, in theory these cells in culture, they keep renewing themselves, but we don't know how long they may last.
I think the research is incredibly exciting, and particularly for the younger women, this is hugely positive. So rewinding the menopause by waking up the ovaries, by developing these stem cells, fantastic for the younger women. For the women having menopause at a normal kind of age, then I would kind of argue that actually, do we really just mean letting women have access to estrogen, and we can actually do that anyway? Do women really want to take on the risks of being pregnant at older ages?
Every generation has its own different elixirs of youth, things that will put off the inevitable decline and death. And there's something very magical about having power and control over reproduction.
There is this sort of culture of youth, whereas our mothers at this age were grannies, you know, in comfortable clothes and slightly thick around the waist and not really bothering about it, because that's what happens at that age.
For women like Claire going through the menopause, it really is a time of change, not only for women but for society.
Sometimes I get a bit annoyed with society because I think, well, I'm 55, why do I have to feel pressure to keep on in skinny jeans, and why do I have to, you know, it's like I'm 55 and I'm expected to look 40. You know, when I'm 65 am I expected to look 50? You know, there is a sort of pressure on, it's not just on young girls but on older women.
I think we're living in an era where so many things have been cured with pills and potions and vaccinations and surgery. We might have the idea that everything can be cured. So I would be quite anxious about over-medicalising womanness. So I think there's a real danger of trying to cure us almost of being human.
Getting rid of menopause altogether may not be realistic in that sense that I guess we cannot make ourselves immortal. Eventually, even if you delay or you come up with new treatments, they all would have some kind of shelf life. The most troubled part of menopause is first 10 years, and I think if we can do something about it, that would be important. And secondarily, if somebody wanted to extend reproductive life, I think extending it to till about age 50 or so is quite sufficient for most people, and after which time pregnancy could be quite a burden.
The benefits of the menopause in the process of aging means that getting rid of it completely is not a prospect that would be realistic, as Dr. Octay says, or desirable. But if new technologies that use stem cells or ovarian tissue transplants can offer more choices for women going through this major life change, or allow those who long to be mothers a chance to do so, it is something that becomes hard to argue against.
Rewinding the menopause.